Are you ready?
What's that?
You don't know this?
Should I be worried?
No, this is our special cocktail for the patients.
Okay, I'll have a double.
Are you sure? Okay, I will join you. Cheers.
To a new life.
Yeah. Woo! It's really bad, okay.
Welcome everyone to another episode of All About Health, the show in which we talk about all things health related and everything about medical travel. Today we're here with dietitian Nayat. Welcome Nayat.
Hello.
Hello. Thank you so much for taking your time to be here. I know you run a tight ship, you run a busy schedule with the patients.
Yeah.
Today I imagine there was already 4 of them starting the liquid diet.
Yes, almost 3 patients, liquid diet, and I prepared first shake for the patients just a few minutes ago.
Best of luck to you.
Thank you.
You're doing an excellent job at this.
Thank you.
I've met them after their diet programs with their shakers in hand. Asked them if there was anything they didn't understand. All was going well. Thanks to you. So as far as I understand, the patients after doing the surgery, they have to follow a specific diet.
Yeah.
What type of diet is this? Because it has multiple stages, yes?
Yes, we have 3 stages, but before I explain the 3 stages, I want to explain right after the surgery.
Oh, so dial it back.
Yes.
It's been a couple hours after the surgery.
Yeah.
There's still some pain, but they're
Yes.
giving painkillers. And your mother's there asking the doctor, is my son gonna be okay?
Yeah, or the parents are texting us from WhatsApp groups about their sons or daughters.
And you make video chats with them showing
Yeah, or
everything's
sending
okay?
pictures.
Okay.
It's very usual for us.
So what's the diet in that time?
Okay, so after the recovery unit, we bring the patient to room and we give the water directly. We are
Okay.
asking to patient, do you want to drink water? If they are not ready, we are waiting for 30 minutes, but if they are ready, we are giving their water directly.
So it's safe to drink water after this?
Yes, of course, but they are going to drink with bottle cap. They can't drink like normal. They should fill the water into bottle cap and then drink directly from the bottle
I tell
cap.
you, if I did the surgery, I'd be so thirsty I'd want to gobble down the whole bowl.
Yes, it's very risky.
Ah.
That's why we are in the room always and helping to our patients.
Okay, so you feed them water little by little.
Yes, every 10 minutes.
So in the evening of the surgery, they continue drinking water, a bottle cap, an hour or every 10
Every
minutes?
10 minutes, yes, and that's it. And the other day, at the afternoon, we prepare a protein shake.
Oh,
We are
so that's what
trying-
I see all the time in the patient's hands.
Yes,
Yeah,
yes.
okay.
We are trying to get used to patients before liquid diet. One day before liquid diet, we prepare a shake.
So the first day post-op is not the liquid diet?
No, it's not.
Okay.
It's just
A
the
trial
liquid.
period, yeah.
Yes, yeah, the trial period for the liquid diet. We prepare a small shake, 100 milliliter, and then they try to drink it in 3 hours. And also,
They tell me it's not easy though. In the first day, they always tell me I tried some sips, but it's not going down. Do you hear
for
that a
some
lot?
patients, it's hard, but for some patients, they're drinking very quickly.
Yeah,
Yeah.
the ones that never talk about the shake is always finish them and just
Yes,
have
they
them by
just
their
leave
sides.
and they just don't complain about the shake. They just enjoy with their shakes.
Yeah.
But the ones who didn't like it, they're always complaining about the shake. They're saying it's very hard to drink.
Yeah. Is the taste unbearable? Is it a bad taste? Because this water I didn't like. The blue water I didn't like. I imagine the shakes taste somehow better, no?
The blue water is the worst thing.
Oh, okay.
Okay,
That's good.
you can ever drink in the world, I think, because it tastes like an ink. No.
I didn't taste ink yet, but looking forward to it after this.
Okay. So after the first day, on the second day, they're going to start liquid diet.
So this is when you give them the lists, when you explain to them face to face.
Yes, and before I give the list, I'm sorry, but I give the blue water.
Oh.
They had to
okay.
drink it because it's leakage test and it's important before liquid diet, they have to drink it.
So the patients I see in the hallway with their blue cocktails in hand, they're on their
Yes.
second day post-op.
Yes, they're on the second day.
But this is the only time they're gonna do that, yeah?
Yes.
Oh, okay,
They
that's
just
good to
drink
know.
One time. So they will start liquid diet after blue water and it will last for 15 days. And they will have shakes and other drink options, water.
I
They
see.
have unlimited drinks.
But just drinks.
Yes, I'm sorry. They can't have solid.
Do they feel hungry? Do they have the urge to eat something in the first days?
Yes, they can feel hungry, especially they feel hungry in mental.
I see. I see.
Because at some point it's impossible to feel hungry.
Because their stomachs is now literally smaller than their eyes.
Yes. They will do liquid diet for 15 days, as I told. After 15 days, they're going to start puree diet.
Yeah, do they have to come back here to speak with you once again for the puree diet?
Before they leave Istanbul, we bring them to the hospital one more time to explain puree stage, solid stage. We give all the comments.
Oh, so there's also a solid stage. So it gets harder gradually. Once liquid and then soft solid and then hard rock.
So we get used to stomach gradually, different kind of foods.
Okay.
Step by step, like a baby.
So that's why in their time at the hospital, they're only drinking protein shakes, milk, and what else?
Broth.
Of course, the chicken, meat broth.
Yes. After liquid diet, they're gonna start puree diet. They are going to eat mashed foods again for 15 days.
I love mashed potatoes. That's when they get the mashed potatoes.
Come on.
No?
No.
Okay.
We are trying to make our patients tinier.
Okay.
They can eat potato.
So instead of potatoes, it's like a mashed
egg, cheese.
Okay.
Maybe chicken soup.
Sounds nice.
Fish. We have lots of options on puree diet.
Good.
It will be easier than liquid diet. Yes. And when they start puree diet, I want to mention something. They're going to start the most important thing. Solid and liquid separation. It's the key of not gaining weight back.
So all the solids to one side, all the liquids.
Yes. So when they have liquids like water or milk, and if they want to eat something after that, they should wait 30 minutes. We should think foods in two categories.
Okay.
Liquids like water, milk, tea, soup.
Okay.
These are liquids. And fruit, yogurt, or chicken, these are solid.
Oh, so even the puree ones signify as solid food.
Yes, of course. So when you have a liquid,
like water, like milk.
like water, you need to wait 30 minutes if you want to have something solid.
I like drinking milk, lactose-free, on the rocks, and I like to eat an omelette.
Okay, so if you want to do this in your breakfast, in my opinion, first start with your omelette. Eat your omelette because egg is a good option for protein. Yeah. After your omelette, you need to wait 30 minutes for drinking milk because egg is solid, milk is liquid.
Why? Why do we have to do this? Because I'm very used to having a bite and then washing it down with a drink at the same time.
Yeah, everybody is used to do that. But now our patient's stomach is very small. They don't have enough space for both of them.
Oh, okay.
So if they force, their stomach can expand and they can gain weight.
And this is what we did the operation for in the first place.
Yes.
Yeah, I see.
Okay. Puree diet will start 15 days after liquid diet.
Okay, so a full month with liquid and then soft food.
Yes.
Okay, then after that I can eat all I want, yeah?
No. Come on, we have rules for 3 months. No spices, onion, garlic, lots of rules for 3 months. So at the end of the month, you can start to eat harder things, but you need to follow your rules.
They can't order food from a restaurant unless they know for a fact that particular plate doesn't include any of the prohibited items.
Maybe, but
because
they
the Turkish cuisine, we love our spices, we love our onion, we love...
Yes, but they can say when they are ordering their food, I don't want spices. Please don't add spices on my grilled chicken.
Okay, so no spice. But that's temporary, right?
Yes.
It's not for life. Oh, okay. So in my 3rd month, I take all the pepper, I take all the other spices, all the Indian cuisine, and I just cook them and I eat them.
No, you need to get used to them, okay? You need to start
slowly.
step by step, like a baby.
So every transition period, as far as I understand, from liquid to puree to solid, it's not a clear-cut line. It's more of a gradual transition.
Yes, step by step.
So I'm eating the purees. I'm separating my liquids, just putting 30 minutes and then eating my mashed food.
Yeah.
And then after the 15 days, it's time to eat solid finally. I do that gradually as well. And by the end of the 1st month, I can already use a fork and a knife
Yes.
to chew, to eat normally.
Yes, like normal people.
Okay, and the prohibited items, when do they come back? You said spices.
3 months later.
Okay, at the 3rd month I can have the spices.
Yes. I have a surprise for you.
A surprise?
Yes.
Love surprises.
I brought protein powders.
Oh, you shouldn't have. This is for me? Thank
Yes,
you.
it is for you. And now we will prepare a protein shake and we will taste it.
My personal protein shake.
Yes.
Thank you very much.
And I think this is the first time you will try protein shakes, right?
I've wanted this for a long time.
Yeah? Okay, so now I will prepare it for you.
So I see there's strawberry here and banana. There's a flour, some kind of, and chocolate. I love chocolate. That's the reason some of our patients become fat in the first place.
Yeah.
Okay.
I'm so sorry for that. So, we have 4 flavor options in our packets. Chocolate, strawberry, vanilla, banana, and you can choose whatever you want, whenever you want.
So all 4 of them are already in the box. Okay, so every day it's a new choice.
Yes, you can change your options. Also, not every day, each meal.
Oh yeah, so how many times a day were these?
3.
3 times a day. Okay, so I can start the day with banana, and then in the midday I can get a nice vanilla and cap it off with a chocolate.
Yes. We need a shaker, of course.
Okay.
So, which flavor you want?
I want the strawberry, please.
Okay.
Yeah?
You can open it.
Okay.
So, I will mix water and milk. Okay.
Water and milk.
Yes, 100 milliliter water and 100 milliliter milk.
Okay.
You can ask me why we are mixing them, maybe.
Yeah.
We have to mix them.
Normally these shakes are prepared with just milk or just water, yeah?
Yes, but if you prepare it with only milk, it will be so thick for our patients. So we need to dilute with water.
Okay. So during the liquid diet, I shouldn't drink condensed juices or something.
Yes, you need to dilute them with water.
Okay. I also need to tell you something. As my dietitian, you have to know this. I don't do well with lactose, you know?
Yes.
Whenever I drink milk, I suffer from stomach aches and gas. So I'm a bit skeptic about this.
Okay, you're lucky because we are using lactose-free milk during the liquid diet.
Okay.
So you're not going to have problems with
and now
the
I
shake.
have my strawberries in hand.
Yes. And for each shake, we are using half of this, okay?
Why?
To make it liquider.
Okay.
Again, the same problem.
So it's not too condensed.
Yes.
Okay. Oh,
so I'm
that's how
pretending you are my patient. If you're not my
Okay.
patient, we will put 200 milk and all the powder, but you're a patient now.
Okay. So when I do this at home, if I didn't undergo a sleeve surgery, I can already use 200 milliliters of milk.
Yes.
That's what I'll do.
But now,
And this is the half.
yes.
Okay. And this part I just mix it with my meals or just use it as salt.
So I think you always want to shake this when I prepare in the room. So it's your turn
But I'm
now.
always afraid because sometimes when you do, it splashes back on you.
If you hold from
To close-
here,
Exactly. Okay. Are we
A
all good?
bit
Doing
more.
A bit more.
Yes.
Okay.
come on.
Okay, there we go. It doesn't look too thick.
Yeah.
Okay.
Okay. So,
Let's hope this will be better than the last one, yeah? Pink is better than blue, I hope.
so cheers.
To your health, yeah.
It's yummy.
Yeah,
No?
it's kind of sweet.
Yeah.
I kind of remember the things they made me drink when I was young to grow up, yeah? Like those special kinds of yogurts where they have the aromas of some
Yes,
fruits.
it's just like that. And also, I feel I'm chewing a gum. No?
Chewing gum?
No? Does it taste like chewing gum?
I wouldn't know. I didn't chew gum for 6 years. You should have checked. But I like this.
Okay, good.
You want some more?
No, thank
I'll
you.
have it.
I had my lunch just a few minutes ago.
Ah, so for our patients, this is pretty much lunch, yeah?
Like a meal, yeah.
I see. So
But
3
only
times
for
a day.
liquid diet. In the other periods, we don't recommend shakes as a meal.
Oh, really? Because some patients tell me they're gonna need protein shakes for life.
No,
Just
they can take shakes as a snack, but not as a meal.
Oh, okay. So it's more important that they eat first and then during their snack times, maybe.
Yes.
Okay. Can I have the rest of the box? I want to find out about each flavor, you know? I want to see how chocolate tastes
I
like.
need to ask it.
Yeah?
Yeah.
Okay.
Okay, because this is for our patients, not for the people.
Okay. Maybe I'll ask the patients then. Thank you so much, Nayat, for explaining the diet plan in detail to me. I know I have a long way to go to learn about the entire process, but now I'll feel much more comfortable when a patient comes and asks me about how the diet will go.
And also you can send them to me.
Of course,
instead of answering
that's
questions.
what I do every day.
Okay, thank you for brightening my busy day.
No problem.
It's a pleasure for me.
I hope you'll be here many times more, yeah?
We
had a lovely time.
We will see.
Okay. Thank you all for joining another episode of All About Health. See you everyone. Bye.